Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and on this episode, we discuss what exactly Equity Afia centers do alongside Business Development Manager Boniface Kagumba. Take a look. Kindly introduce yourself to our audience.
My name is Boniface Kagumba. I work with the Equity Afia Medical Center here in Ruiru. So here representing several branches in the region.
So which branches are these?
So the one that we have here is Ruiru 2, so which is located at Devki, right opposite Devki, Ruiru, at AIPCA Church. We have a new building there, so we are there in first floor. Yes, so we have other branches that in this region. So we have Equity Afia Juja, we have Equity Afia Kenyatta Road, we have Equity Afia Kimbo, Equity Afia Ruiru 1, and also Equity Afia Kamakis Bypass, and Equity Afia Githongori. Yeah, so and very soon we're also going to have another branch at OJ.
So we can't assume that everyone knows Equity Afia. So what exactly is Equity Afia?
Good one. So Equity Afia is a medical center. It's a franchise network of medical practitioners who came together through Equity Foundation. They've with a mission to offer standardized, quality, and affordable healthcare to all. So generally, it's a medical center that offers mostly primarily healthcare, but also specialist health services as well.
Okay, so what specialties are these?
We have from the basic, we have immunization. We have immunization services, the nursing services. We have general doctor consultation. We have dental services. We have optical services. We have physician specialist. We have dermatologists, ENT. Nutritionists, we have orthopedic surgeons, and more specialists are also coming on board. So with the most recent one, also we are looking forward to do more of imaging services. Yeah, so we are the one we have the imaging services right now is for ultrasound, but we're going to do more like X-ray. Yeah, so many other equities are here, so going on that level. So now as you said, it's standardized. So each equity affair you work in, you're going to find more all of them having uniform service.
Okay, so is Equity Afia affiliated with Equity Bank Limited?
Yes, as I said, Equity Afia is affiliated to Equity Bank. It's one of the mission of Equity Bank is to promote healthcare to the community at large, and not just here in Kenya. So they also have a mission of doing this in Congo. So currently, from what I know is we have 118 branches in Kenya, and I guess Congo we have around 5 upcoming. Or they could have started. Yeah, so we want to be the leading healthcare provider in East and Central Africa and beyond.
So what is the typical patient experience in Equity Afia?
The typical patient experience, the first time you come in, definitely you walk into a hospitable reception, you join, and then they walk in you to the journey to the triage, where you get the basic test done by the nurse. The triage test, that is blood pressure, BMI. That is the body mass index. They also get to do the SpO2, and then after that, the waiting period is not much before you go to the doctor.
So is this experience standardized across all Equity Affairs?
Yeah, so that is the number one thing. The first thing you come in is you get to the reception, and then to the triage, to the doctor, and then from the doctor now they can decide whether you're going to the imaging, to the lab, or it's a referral.
Mm-hmm. Okay, we also have this notion that most of the doctors in Equity Afia tend to be those from the Equity Leadership Program. Do you take the people who scored A's in their exams to be the doctors, or is it for everyone, including anyone who probably didn't qualify for the ELP?
So mostly for the ELP ones, also be mostly the directors are mostly the founders of the Equity Afia clinics. Yeah. So on top of that, they ensure that at least they have quality doctors from all across the country and beyond. So we have doctors in all branches, not necessarily the one that are under ELP.
Does Equity Bank Limited offer insurance within the same franchise?
Yes, so Equity Bank are one of our partners. They do have insurance. They provide insurance. Actually, most of their staff members are under that insurance, and we see them here at Equity Afia. So, and the insurance is also open to the public. So you can walk into any Equity Bank and ask for a bank assurance person. They'll guide you through the insurance based on your needs. So if you're an individual, you want a medical insurance, just walk into any Equity Bank. They will guide you. And then from there, you can walk into any facility, including Equity Afia, with the insurance. Yeah, so it is not that Equity Afia is the one that gives the insurance. It is Equity Bank that gives the insurance.
Do you have inpatient services?
We don't have inpatient services, but we have branches that are 24 hours. They offer 24-hour service, and this is one of the branches. So Equity Afia Ruiru offer 24-hour services. The other one that we have along the road that offers 24-hour services is Equity Afia Kasarani. Yeah, so anyone along that side can be able to access medical services at Equity Afia Kasarani or Equity Afia Ruiru for 24-hour service.
Okay, so being very novel in the industry, have you faced any challenges so far within the healthcare industry?
Not much challenge, because as I said, we normally there's a lot of scrutiny that comes in before a doctor is given a job at Equity Afia. So that is ensure that at least we take the best. So we don't have that much challenge because we have competent workers. We have a good team, and the energy is just good. Yeah, with the team.
So what are the goals that you're hoping to achieve through this franchise?
With the franchise, we have a plan to have over 1,000 branches in the country. Yeah, so that is the goal for Equity Afia. So more than 1,000, and definitely to ensure that at least the community gets standardized, quality and affordable healthcare. So that means that if you are in Hola, you can walk into a facility and get treated. You don't need to come to Nairobi. If you're in Kisumu, if you're even in the outskirts like Isiolo, you can be able to get the services. So here in Ruiru, we even gone further, as you said, you've even gone to Githongori. So the people of Githongori are enjoying the same service as the people who are enjoying in Ruiru town. So standardization is a clause everywhere, regardless of where the Equity Afia is.
Okay, are we going to look forward to you guys having a big hospital with inpatient services?
Yeah, those are the plans. I've had our directors tell us that in future that is the plan. So we are hoping that and we will welcome it since the growth has been good and the people have adopted Equity Afia. Seems we are doing a good job.
So let's talk about the financial aspect. Do you integrate insurance?
Yes, we accept both cash and insurance. So majorly all the private insurances are accepted at Equity Afia. There are some of institutions, Equity Afia, that accept NHIF for civil servant and even the other one. So the best thing is just walking into an Equity Afia and find out whether your insurance is accepted by, and then if it is not accepted in that Equity Afia, they'll show you which one is accepted. Yes.
So I have also seen and taken part in many Equity Afia programs where they give back to the community. Could you talk about this so that other people actually know, other than offering healthcare services, they're actually giving out to the community?
Yeah, thank you. So yeah, this is good. That is actually part of my docket here at Equity Afia Ruiru block. So we have a lot of CSR that we do across the community. We do walks. We do medical camps. We do health programs to the community, like health talks to corporates. Yeah, so we ensure that at least we even become part of even like go to children's home. Community at large. We take part of even liaise with other stakeholders in health to dispense information about health. Yeah, so every week we normally like have more than 3 activities in this region.
Okay, so also do you offer nutritional services from experts in the nutritional area?
Yes, we have nutritionists on board. Yes, and even psychologists. Yeah, so we have nutritionists as part of our specialist list.
We're taking a short commercial break. Don't touch that dial. We'll be right back. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We are continuing the conversation on what exactly Equity Afia do. Take a look. So maybe Dr. you can introduce yourself to the audience.
So my name is Dr. Najib Nizar. I'm a medical officer who has started working with Equity Afia recently, and we just opened a new branch. I studied in Kenya Methodist University. I did my internship in Nyeri Public General Hospital, worked at Medihill for some months, and now here I am.
Okay, so the topic of the day is monkeypox. What exactly is monkeypox?
Monkeypox is a viral infection that is usually spread by, there are 2 types of spreads. One is animal to animal spread, and the other one is animal to human spread. It is a viral infection that usually has symptoms of fever, a rash, lymphadenopathy, and the rash is of a vesicular kind. It has fluids and it has a central umbilication in it. So currently we refer to monkeypox as mpox because of the stigma that was associated with monkeys. So they decided to rename it mpox. Then we also have had currently we have had 3 suspected cases, not 3 confirmed cases, and we have had 29 suspected cases as of 6 days ago. Yeah.
So how is it exactly transmitted from animals to humans?
So number one, the animals that transmit this virus include bushmeat. So the bushmeats that the animals that are considered bushmeat include monkeys, they include prairie dogs, they include rats, they include they include also other animals such as gazelles. Yeah. So these are even the squirrels. These are the hosts that have been known to be natural reservoirs, meaning they have the virus in their body without any symptoms, and they have natural antibodies against it. So when someone ingests those uncooked or raw meat from those type of animals, then they can easily be inoculated with the virus. Number 2, having contact with those animals. So for example, like let's say you have imported a dog from West Africa or from Central Africa, then the dog has the prairie dog, they have like the manifestations of the monkeypox, such as the fever, the rhinorrhea, they also tend to have lymphadenopathy. So they can spread that, like when you contact their saliva, when you get in touch with their saliva or with their feces and all that, like fluids in general, they can spread it to you. It can be inoculated. Sometimes even the contact with lesions, like for example the rash that is there, when you can touch it, and you can easily inoculate it to you.
Okay, so is it a novel virus?
It is not a novel virus. So it was discovered in 1958 in monkeys in Denmark. Then nothing happened. In 1971, when we were having the eradication of smallpox, the people in DRC, the WHO that was based in DRC, they noticed a 9-year-old boy who developed similar features to smallpox. So when they did the investigations, they found out it was monkeypox. So we have had it for long. 1971, then we also had a 1997 outbreak again in Zaire, which is the DRC. Even the 1971 case was in DRC. So in 1997 we had an outbreak there. In 2003 we had an outbreak in US, and in 2022 we had one in UK. Right now we are having one in Kenya. Yeah.
Okay, so you've also mentioned that it is caused by eating bushmeat, and we also know that Ebola is also caused by eating bushmeat. Could you tell us the difference between the two?
So monkeypox does not have hemorrhagic fever. So Ebola, most of the time, when you have Ebola, you will notice that you are having bleeding from your orifices, so including the mouth, the anal region, from your blisters, you see. But in monkeypox, it is a milder form. It's even milder than smallpox, by the way, because there is some studies that have been done showing that people who had been vaccinated for smallpox with the vaccinia virus, with the vaccinia immunoglobulin, actually they had milder forms. So Ebola is more serious than monkeypox. It's also caused by bushmeat, yes, but you have that hemorrhagic fever that monkeypox does not have.
Okay, and is monkeypox as fatal as Ebola?
No, Ebola is more fatal. Yeah.
Okay, so in terms of fatality, is it in terms of maybe the numbers? Does monkeypox cause death?
Monkeypox, so far in Kenya, it has not caused any death. All of our patients have recovered. We had one in Taita, Taita Taveta County. We had another one in Busia. The third case was in Nairobi, so they have been isolated. So far, no mortality, but from the studies that have been done, it has been known that African population has had a mortality of up to 10%. Yeah, from the previous outbreaks that you have, especially the 1997 outbreak.
We've all seen the lesions that monkeypox causes, and most likely people are going to say, maybe it's just chickenpox, especially when they say it to children. Could you tell us the difference between the two?
So, first of all, the type of the rash. So, the rash of monkeypox, usually it begins from the face. From the face, it then spreads downwards, so we call it craniocordial spread. And usually they have different types of lesions that you'll have. So number one, you can have a pustule, which is pus-filled small papules. You can also have vesicles that are blisters. In layman's term, they're blisters. Then you can also have macules. So in monkeypox, usually you will have that same type of lesion throughout the body. So for example, like you'll have macules, papules, all of them are the same. You see, number one, they are starting craniocordially. Then for the chickenpox, usually most of the time it's fluid-filled blisters. So we call them vesicles. Anything that is fluid filled, we call it vesicle. So the vesicles usually they start from the chest, face, then they spread to the rest of the body, and most of the time they spread to the rest of the body, including the genitals also. See, then chickenpox, most of the time it's itchy. Smallpox is not itchy. Also the progression of the rash. So monkeypox, the mpox, most of the time it's slow. That's why you tend to have same types of the lesions throughout the body, because it's slow. For chickenpox, it's rapid. Yeah. And also we can also differentiate it with smallpox, whereby smallpox will have Koplik spots. So usually they start from the tongue and the mouth, and they spread small red petechiae or pustules. They spread throughout the rest of the body. Yeah.
So I think the main public health concern right now is human-to-human transmission. Could you tell us a bit more about that?
So human-to-human transmission, the monkeypox, the mpox is being spread. It can be spread via respiratory droplets. So it's advisable you wear a mask. It can also be spread via contact with the lesions. So for example, if you have a cut, if you have a scratch, and then you touch that lesion without protective equipment, you can get that infection. You can also spread it sexually. So like most studies have been done showing that men having sex with men have presented with the monkeypox that is only anogenital. So like from the penis and the anus, you will find those lesions there, like they're focused there. So we do say it's also sexually transmitted. Yeah.
And is it as rapidly transmissible as COVID?
Yes, it is. Yeah. Because of the respiratory inoculation, it is as rapidly transmissible as COVID, but the complications of bronchopneumonia are a bit less. Like, yes, there are the complications that are there, but most of the time the complications are skin manifestations.
So we are in the ultrasound room. What exactly is this device?
So this is an ultrasound machine. So one of the imaging we have here, when the doctor is required to do more investigation, like an obs gyna send you to do a scan for expectant mother. So this is a machine that it is used. It also do the abdominal and pelvic ultrasounds. Yeah, so we have sonographers that use this machine. Yeah, so this is part of our imaging that we do here. This is a pulse oximeter, so one of the equipment that is used in the triage point. Yeah, so especially for the sick patients. So it checks your oxygen level. So it was very common during the COVID. Yeah, so you just pop in your finger like this, and then you switch it on. Within a few minutes, it will give you the percentage.
Okay, where does it read the percentage?
So the percentages are here. So you have to make sure that preferably the person is supposed to have rested. You can have a seat. So the numbers are there, so it keeps on changing. Yeah.
So we are currently in the optic unit and we are headed over to know what some of these things are. So Daktari, what are these?
So here at the eye unit, we have different types of instruments that help us during eye assessment. The one in front of me is a slit lamp. This one we use it to check if there is any anomaly at the back and the posterior part of the human eye. We also have the autorefractometer that we use to check if you have a refractive errors. Refractive errors, examples of refractive errors are people who are short-sighted, long-sighted, people with astigmatism, etc. So we also have the LCD chart. This is a computerized visual acuity chart. A visual acuity chart is to determine whether you have an eye problem. If you go to any hospital or any eye hospital, this one is normally the initial first test that we do. You will sit at a distance of around 6 meters. You close one eye, you try and read the letters. So basically it is an entry point kind of a machine that helps us to determine if there is a problem with the eye, on which direction to go as doctors. Also, we have a trial box. A trial box contains series of lenses that we try to it helps us to determine if you have also refractive errors. We have the minus lenses, we have the plus lenses, we have the cylinder lenses that are used to correct astigmatism. We also have the accessories. These accessories can be used to determine if you have we call them tropias, whereby you see your eyes are seeing sideways. When you're looking straight, your eyes are seeing sideways. They help us to determine such kind of problems.
Okay, so Dr. what exactly is this and what is this room for?
So this is a telemetry machine. We usually use this kind of monitor in the ICU. So it can measure your blood pressure, it can measure your pulse oximeter. It has leads whereby you attach it on the chest, and you get monitoring of the heartbeat, of your breathing, of your oxygen levels, and also your pressure and mean arterial pressure, and your temperature also. Then it also gives you the general picture of how the heart works. It's not an ECG machine, but at least in emergencies you can identify the different patterns. Yeah, so it's an ICU machine. It's called a telemetry machine, telemetry monitor. Yeah.
What is this room?
So this room is our procedure room. Usually we stabilize patients here. Let's say for example a patient has come to us, a child who requires IV medications. So this is the place where we cannulate, we give the medications, we give the fluids. Also procedures such as dressing of wounds, procedures such as suturing, they all happen here. We also have an emergency tray there as per the ACLS protocols by the American Heart Association, and in case if you have a patient who is in cardiac arrest, we do the management here.
As you have seen, Equity Afia is not limited to the services they offer, from dental to pediatrics, all the way to nutrition. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.